What's up guys, Dr. Jared here, and these are the best exercises to eliminate pain in your sacroiliac joint. This is pain that you get way down here, kind of in your lower back, so it's not quite your lower back, it's down below that, kind of back here in the posterior hip area. A lot of times that comes from sacroiliac or SI joint dysfunction. We're going to talk about what that is, why you get it, and then I've got a few exercises that you can do at home to strengthen and stabilize this area. That's going to help you to not only get out of pain right now, but to also prevent pain from coming back in the future. That's the benefit that I hope that you get from this video. So first of all, what is the sacroiliac joint? Well, you've got your pelvis and it's made up of 3 bones. You've got 2 iliums on either side. These are your ilium. And then you've got this wedge-shaped bone right here in the middle. That's called your sacrum. Where those 2 bones come together is called your sacroiliac joint. Now, we call it a joint because it's simply where 2 bones come together, but it's not a joint in the traditional sense that movement occurs there. In fact, no movement should occur there. That should be a very stable structure to support your pelvis. When there is movement in that area, and there's a lot of different things that can happen, one bone can slip up, it can slip down, it can flare in, it can flare out. When it's not seated in the exact way that it should be, that's what causes that lower back pain. Typically it shows up just on one side, and again, it's kind of right down here in that sacroiliac area. Our first step with this is to seat those bones in the proper position. So to mobilize them and to get the alignment just right. I actually shot a video on that one a couple of weeks ago. I'm going to link it in the description down below. I'll also link it at the end of this video. That is going to help you to get those bones seated into the proper position. I highly recommend that you start there. Then, once those bones are in the right position, it's crucial that we strengthen and stabilize the muscles that are going to keep it in that position. That is exactly what you get in this video. So it's one thing to put them in the right spot. That will help pain immediately, but now the goal becomes we want to strengthen and stabilize and keep them in that right spot to keep you out of pain in the future. And so that's exactly what I want to show you in this video. I've got 4 exercises. You can do them right at home, no equipment required. Again, with the goal being to stabilize that SI joint and help you out of whatever pain you might be experiencing. So that being said, first exercise coming your way right now. Now, before we get started, is it okay with you if I over-deliver in this video? You guys know me, my standard is to give you the best possible advice to help you to achieve the best possible outcomes. I couldn't do that if I didn't mention this one thing about sacroiliac joint pain. Just like it's crucial that you perform the right exercises to help it feel better, it's so important that you avoid the wrong exercises that are going to make it feel worse. And so the 2 activities that I definitely recommend that you avoid are going to be anything that creates torsion in your pelvis. And so lunges are probably the primary culprit on this one. It's just not the best position to put your pelvis in and to stress in that way. And then also single leg activities. And so single leg deadlifts is certainly a big one here. Anything that's going to cause shear or a lot of rotation, asymmetrical rotation in your pelvis should definitely be avoided. Instead, we're going to do exercises that work our glutes and our hip extensors and also our deep hip rotators, because those are the muscle groups that actually cross that SI joint, and those are the groups that are going to help to stabilize that area. We're going to do them in a non-weight bearing position, and then we're going to progress into standing, but you'll notice that with the standing exercises, we're keeping both legs on the ground and our weight balanced between our 2 legs. So please keep those things in mind. And then the last thing that I want to mention is that you can do all of these exercises without any equipment, but if you do have some of these resistance loops, they can actually enhance the contractions and kind of make your outcomes even better, just enhance the effectiveness of the exercise. So again, not crucial to have, but if you do have some either at home or at the gym, they can really help to improve this. If you're interested in picking some up, I'm going to go ahead and link some in the description down below. It's a great set that you can buy to, again, hopefully just take these exercises to the next level, make them that much more effective. Okay, so that being said, let's get into this. Your first exercise is going to be a clamshell. What you're going to do is lay down on your side. I typically start with the affected leg up or with the affected hip up. So in this case, that would be my right. You're gonna lay on your side with your knees bent, my feet are together. Now we're gonna use those deep hip rotators to pull my knees apart, hold 1, 2, 3, and then return right back down to that starting position. Again, you should feel this kind of deep in your hip, deep in your glute. That's right where those hip rotators sit. We would do about 15 to 20 reps on this and then flip over and do 15 to 20 reps on the other side. I would repeat that 3 times on both sides. Now, if you do have that resistance band, all you're going to do is sneak that right around your knees in that position. And now all of a sudden we have a little bit more resistance to pull against, just like that. Again, just takes it to the next level, increases the strengthening on it, makes it a little more effective. Now, exercise number 2 is going to be for your glute med, or kind of these lateral glute muscles over here. This is a side-lying hip abduction. So again, I'm laying on my left side. Now my left leg is bent and my right leg is out straight. Now, typically what I recommend, or what I tell people to do here, is we're gonna lift our heel up towards the ceiling. But in this case, I want to kind of kick on a little bit more of the glute max. We need to get into a little bit more hip extension. So typically what I tell people with this, for the SI joint, in order to perform this exercise, starting in this position, I'm not only going to lift my heel up towards the ceiling, I want to take it back at an angle. So it's actually angled back behind my body and then return it right back down. And so we're not just lifting straight up and down, we're actually trying to kick on those hip extensors, those glute muscles, as we lift it back behind us as we're lifting it up in that position right there. And so once again, about 15 to 20 reps on the right, 15 to 20 reps on the left, and then we're going to repeat that 3 times. This one can also be enhanced with the band around your knees, just like I'm showing you right here. All the mechanics look the same, just a little more resistance with the band around your knees. Now let's get into the next exercise. Number 3 is going to be some bridges, or some glute bridges. Another just great way to activate those glute muscles. Lay on your back with both of your knees bent. Now really simply what I want you to do is contract your glutes, so squeeze your butt, and then use that contraction to lift your hips up towards the ceiling. We're going to hold 1, 2, 3, and then we're going to slowly return back down to the starting position. Now, if you're strong enough, feel free to hold that for a little bit longer. I'll go up to 5 to 10 second holds with patients in my clinic. Just a great exercise to, again, get the glutes going. Both of my feet are down, so it's a very safe position for your pelvis. You get some lower back activation with this one as well to work on the stability there. 3 sets of 15 to 20 reps is what we go for. Now with this one, this is one of my favorite ones to actually add the bands to, just because what that's going to do is try to pull your knees together. So in this position right now, my hips, knees, feet are kind of right in this straight line, but that band is trying to pull my knees together. I have to kick on my hip rotators and abductors to keep them out in that straight line as I pull up into that hip extension. So with this, I'm actually kicking on glutes and hip rotators at the same time. Again, the mechanics are the same. Hold 3 to 5 seconds and then return back down. But again, your primary emphasis is I don't want your knees to come together, so keep your knees apart and then use the glute contraction from there. So that's an easy way that we can take those glute bridges to the next level. Okay, so that's all the exercises we're going to do on the floor, on the mat. Let's get up into something standing and a little more functional. Now, this last exercise is one of the most functional movements that a human being can perform. We're going to finish with some squats, or some air squats. This is what it looks like. I want your feet slightly wider than your hips. The first move with this is to break at your hips, meaning I want your hips to go backwards. That's the first move, and then lower yourself down into a squat. I want you to go down just as low as you can. From this bottom position, squeeze your butt and use that to push up out of the squat. Knee position is important on this. I don't want your knees to buckle out, so I want you to try to keep your knees right over your toes. And I want you to go down just as low as pain and mobility and strength will allow. So even if that's just a little quarter squat or a half squat like this and then push up out of it, that's a good place to start. But the goal is to get down into that deep squat as much as you can. And then again, we're driving that motion with the glutes to push ourselves up out of that. I even like to tell people up at the top, squeeze your butt. So like contract your glutes up here at the top to even get that much more contraction out of that area. And again, about 15 to 20 reps 3 times is a good number to shoot for. And then just like the other exercise, just like the other exercises that I've shown you so far, we can enhance this one with a band right here around your knees. Once again, that band is going to want to pull my knees together. As I drop down into that squat, my objective is to keep my knees out right over my toes, right in line with my hips, so I stay in this really good alignment and this really good position. What that's doing is, again, kicking on those hip rotators and abductors to keep my knees in the right position as I perform these squats. And so that's what the technique looks like. Numbers remain the same even if you've got that band around your knees. Now, I mentioned at the beginning of this video that I've got a great video on sacroiliac joint mobilization to put your SI joint in the right place. If you want to check that video out, you can do it right here. For some reason, YouTube thinks that you might like this video from Tone and Tighten. Check that out, see if YouTube's right. If you haven't subscribed yet, I'd love to see you back here for future videos. Hit this circle right here to do that. Hope this helps, and we'll see you again soon right here on Tone and Tighten.